Dear learners, welcome to the CCE LMS portal. This is Dr. M. Naga Prasanna, working as lecturer in zoology, Government College for Women, Guntur. In this lecture, you are going to learn about the care and management of dry, pregnant and milch animals. The learning objectives of this lecture are: you will understand about the dry period and its importance, and you will gain knowledge about feeding, care and various managemental practices that are to be followed to the dry, pregnant and milch animals. First, let us see the management of a dry cow. Dry cow should not be neglected in a dairy farm. Better caring and management of dry cow leads to the better performance after their parturition. What is a dry period? The period between the date of drying. Drying means here stoppage of milk production. So the period between the date of drying of pregnant animal to the calving of newborn is called the dry period. Usually 2 to 2.5 months of dry period is followed. Next, management of dry cow. Purpose of drying. What is the purpose of drying a cow? This is to give the milk producing cow a period of rest. Feeding and minerals taken by the animal should not be used for production of milk, but it should be used for the better growth and development of the fetus. Drying makes the cow the ability to calve at correct body condition and also the ability to produce high quality milk during the lactation. Next, feeding. During dry period, green fodder along with 1 to 2 kg concentrate and ration should be given. Usually dry cows consume more energy than required and this should be checked. Maintain calcium intake below 100 grams and phosphorus intake 40 grams per day. And also provide them with vitamin A, D and trace minerals. Other management practices. They should be dewormed before and after calving. After calving, raise the grain intake by 1 kg per day as it requires more energy after calving. Next, let us see the care and management of pregnant animal. If a pregnant animal is managed properly, it will produce a healthier calf and also ensures high milk yield after calving. Proper health care and providing nutritious diet will help in the rapid growth of female calf and reach early puberty. To such animals, if timely insemination is done, they can produce calves at the age of 2 to 2.5 years. The gestation period of cow is 270 to 290 days. During the first 3 months of pregnancy, special care should be taken to avoid abortion and take adequate care in the last 3 months of pregnancy as 70% of the fetal development takes place during this period. Avoid grazing of animals in faraway places and also in uneven paths as it will lead to slipping of the animals. The animal should be provided with enough space to stand and sit comfortably. They should be provided with suitable ration to reduce the risk of diseases like milk fever and ketosis at the time of calving. Milk fever is caused due to the insufficient calcium and ketosis is a metabolic disorder that is caused due to the lesser energy intake than it is required. And ration also helps in producing adequate quantity of milk. They should be provided with fresh and clean water round the clock and protect from the heat stress. Other management practices. Infighting between the pregnant animals should be avoided. Avoid chasing by dogs, bulls or children. Also separate the pregnant animals from recently aborted cows. After 6 to 7 months of gestation, they should be tied with other milking animals so that they get accustomed to the milking practice without any excitation. Pregnant cows should be shifted from parturition pen 1 to 2 weeks before calving. Observe the animal during the last 1-2 days before parturition. The following feed should be given daily to the pregnant animals. Green fodder 15 to 20 kgs, dry fodder 4 to 5 kgs, compound cattle feed 2 to 3 kgs, oil cake 1 kg, mineral mixture 50 grams and salt 30 grams. Parturition. Parturition is nothing but the delivery. Dairymen should be available to provide the help in the case of any emergency. In labor prolongs more than 4 hours, it leads to dystocia, that is abnormal presentation of the fetus. Then seek veterinary aid. After parturition, external genitalia, flanks and tail should be washed with warm water with some crystals of potassium permanganate or neem leaves. Feed laxative should be given 3 to 5 days before and after calving. Take veterinary help if placenta does not leave even after 2 to 4 hours. Next, care and management of milk animals. Proper feeding, care and management of lactating animals will produce high milk yield during every lactation. Next, feeding of animals. The parturient cow should be fed with mild laxative, palatable and energy-giving feed immediately after the calving. Roughage like green legumes and dry fodder should be given to avoid bloating in the animals. For every 2 to 2.5 liters of milk, provide 1 kg extra concentrate along with the salt and mineral supplements. Feeding should be planned in such a way to get peak milk production in about 40 days. They should be fed with concentrate mix before or after milking and roughages after milking. This will avoid dust in the shed. Housing. Each cow is to be provided with a barn space of about 5 into 1.2 meters and feeding space of about 0.6 to 0.7 meters. Provide loose housing with shelter to protect the animal from sun, rain and wind. Flooring should be hard, non-slippery and slopy. Other management practices. They should be handled with kindness and avoid frightening and exciting the animals. If proper feeding is done, they will come to heat within 16 days of calving. If any signs of heat are noticed, its service should not be withheld. Remember that the lesser the interval between the calving, the more will be the efficiency of the animal as a lactator. Maintain breeding, calving and production records to attain maximum profits. Grooming should be done 2 hours before milking to avoid contamination of milk with hair, dust, dirt or dung particles and to achieve clean milk production. Daily brushing will help in removal of loose hair and dirt from the coat of the animal. Follow regularity in milking. Rapid, continuous dry hand milking should be practiced. Milking should be done with whole hands but not with the thumb or index finger. Before milking, udder should be washed with 0.1% potassium permanganate solution and wiped off with a clean cloth. Generally, the cows are milked twice a day, but in cows giving more than 10 liters of milk per day, milking should be done thrice. Check for mastitis periodically. Mastitis is nothing but the inflammation of udder tissue during the infection by microorganisms. Also, common ailments should be detected and treated. Ailments means illness. So, common illnesses should be detected and treated. Common vices. Vices means bad behavior. So, common vices like kicking, licking, sucking should be checked and avoided. Maintain adequate dry period for subsequent lactation. Routine vaccination and deworming should be practiced. To control ectoparasites, regular spraying of insecticides should be followed. Summary. Period from the date of drying into the next calving is called the dry period, and purpose of drying the cow and its feeding you have learnt already, and gestation period of cow is 270 to 290 days. Before 1 to 2 weeks of expected date of calving, shift the cow to individual parturition pen. The animal should be kept under observation during the last 1-2 days before calving. Before calving, large and swollen udder are present. Loose housing with shelter should be provided to milk animals. A cow will come to heat within 16 days of calving if proper feeding and care are taken. Milking should be done with the whole hands but not with the thumb or index finger. So with this we have completed the care and management of dry, pregnant and milch animals. Thank you all, and I especially thank the CCE for giving this opportunity.